Welcome to North Bay 101, a weekly analysis of the top stories from California's North Bay region. Reporters and editors from 5 surrounding counties take an in-depth look at the headlines shaping our community. I'm your host, Noah Abrams. On today's show,
2.2 million Californians are expected to lose their insurance over the next 4 to 5 years.
Also,
it is such a privilege to see how tough you can be. It is so cool to go out there, to set a challenge before yourself and to accomplish it. And I was like, I want to do more.
Let's jump right in. Kristen Hwang, healthcare reporter for Cal Matters. Welcome to North Bay 101.
Thanks, it's great to be here.
So you've been covering a lot of the changes that are happening with Medi-Cal, Medicare, as it's known federally, and to the healthcare system in California. Is that right?
Yes, the Big Beautiful Bill contained, a plethora of things across all kinds of different fields, but healthcare was certainly a big, issue and subject of debate during the passage of that bill.
And so it's making changes to eligibility, it's making changes to who is able to be covered. When are these changes expected to go into effect, and what are some of the biggest ones that folks might feel in their day-to-day?
The One Big Beautiful Bill, the changes kind of have this cascading effect over the next couple of years. In addition to the One Big Beautiful Bill, the state of California also implemented its own changes and restrictions to the Medicaid program, or Medi-Cal, as we call it in California, because the One Big Beautiful Bill changes the funding for the state, and so that squeezes the state's budget. One of the things that California has already put into place that started at the beginning of this year was restrictions on eligibility for undocumented immigrants. People who are already in the program are eligible to stay in the program, but no new adults, I should say, can sign up for Medicaid if you're undocumented. And then the One Big Beautiful Bill, in terms of eligibility changes, the biggest thing that it's doing starts in January, and those are work requirements. But essentially, it's requiring a certain segment of the Medicaid, Medi-Cal population to prove that they're either going to work or to school for at least 80 hours a month. And if you're not able to prove that, then you would get kicked off of the program. And it also it shortens eligibility periods as well from a year to 6 months.
Yeah, and some of the experts are concerned that that's going to be a really damaging change. In a recent documentary that Cal Matters did called The Cut, you all spoke with Mark Peterson, and he's a senior fellow at the UCLA Center for Health Policy Research. Let's play the clip and hear what Mr. Peterson had to say.
And for the first time in history, through explicit policy choice, we are now boosting the percentage of the uninsured population in the United States.
Yeah, kind of collectively through both the federal government actions and the state's actions, about 2.2 million Californians are expected to lose their insurance over the next 4 to 5 years. And that's from the UC Berkeley Labor Center and research from the UCLA Center for Health Policy Research. 2.2 million people would effectively be doubling the uninsured rate in the state. So it certainly is going to have a large impact in California.
So let's go to Jesse Hoagland, who is a physician assistant who works at a health clinic, to really hear that perspective. And Hoagland was spoken to for The Cut, the documentary that Cal Matters recently did about some of the changes that are going to come to the healthcare system. But I want to hear from Hoagland about what they had to say about what it's like when somebody who's uninsured comes in and needs immediate care.
When someone does not have insurance, it really comes down to what can they afford. If they cannot afford insurance, can they really afford these medications? If I had someone who was having abdominal pain or pelvic pain and I needed them to do an ultrasound and I know I couldn't wait 6 months, I would have to send them to the emergency room, which is even more expensive than just getting the ultrasound.
So, Kristen, you said that there's more to explain about what Hoagland was talking about in these healthcare settings.
Yeah, when I was speaking with Jesse Hoagland, he's been a physician assistant for a very long time in a community health clinic that provides healthcare primarily for underserved, impoverished populations, people who either are on Medi-Cal or they're uninsured. So he was able to really make this comparison for me of what it used to look like before the Affordable Care Act allowed states like California to expand their Medicaid program to people who previously didn't qualify. And at the time, California had the highest uninsured rate in the country. And so when somebody was having a healthcare, a stomach pain, he talks about, or some other issue, and they would go into primary care had no option but to send people to the emergency room, which is very expensive. Both to the patient and to the healthcare system. He was telling me that after Medicaid and Medi-Cal expansion, the number of uninsured people in California dropped drastically. About 5 million people gained health insurance at the time. And so he was really fearful about these recent federal and state cuts, making that the reality again.
So I want to get to as well, you took a look in one of your recent articles at the start of this month at a hospital closure in Los Angeles that, had real big ripple effects, not just for the community that the hospital was closed in, but other healthcare providers and settings in the immediate area. So could you talk a little bit about the hospital that you looked at?
Yeah, there's sort of a case study in Los Angeles of the King Harbor, or sometimes known as King Drew Hospital, closing in the early 2000s. That was a hospital that was actually shut down by federal and state regulators for very, very legitimate and concerning quality issues. But kind of what its closure created was this case study that researchers then went back to see, what happens when a hospital closes? What happens when a major trauma center closes? Where do all of those patients go, and how does that affect the system? They found that the surrounding hospitals became very stressed out. Their emergency rooms, suddenly the wait times were like 11 to 18 hours. They found that there was less access to care for all patients, and there were some worsened mortality measures as a result of that hospital closure as well. And that's something that people have talked about in regards to federal and state Medicaid cuts, is that really the expansion of Medicaid is something that helped hospitals stay afloat back in the early 2000s. Because like Jesse Hoagland, the physician assistant, was saying, if primary care can't take care of a patient because they're uninsured, they have to send them. The only option is the emergency room. And then hospitals by law are not allowed to turn anyone away from the emergency room. And so what ends up happening as a result is that suddenly hospitals are taking care of many, many more people, essentially for free. It's called an uncompensated care cost. And when that happens, like, hospitals just suddenly have this big hole in their budget, and they have to figure out what to do with it in order to, stay open or maintain services for everybody else. And unfortunately, we kind of know that very financially fragile hospitals are likely going to close, and those are often concentrated in either urban low-income areas or rural areas of the state that already have very limited access to healthcare. Or hospitals might start to close down other services. They might shut down their ER to just stop that altogether. They could stop labor and delivery, cancer centers, things that are very expensive. And that kind of service reduction or the loss of a hospital is something that affects everybody, not just people who are on the Medicaid or Medi-Cal program.
Absolutely. I mean, we've seen, it's been well documented by Cal Matters as well, but we've seen in Sonoma County and on the North Coast that some of the hospitals have begun to scale back their birth center services. And so it's become more challenging for expectant mothers and women who are going into labor to be able to find a place to actually go and deliver their baby. It's a really live question for folks in rural or underserved parts of California.
It is. And I think the California Hospital Association says that 50% of hospitals in California are currently operating in the negative.
I want to go to one final clip from the cut from Ramont Means. He lives and works in South Los Angeles, and he was just kind of speaking about the actual lived day-to-day challenges.
I don't have the luxury of taking off work, going to the doctor without it affecting my income. Today was an example of that. Because I wanted to go to the doctor, I had to miss work.
All right, I got an appointment like at 2 o'clock. My name's Ramont Means.
I work 2 jobs. Everybody knows the game in California. You want your check or you want benefits. You can't have both. So I'm on Medi-Cal.
So, Kristen, really, what would you say from your most recent reporting is the big takeaway that California residents should be thinking about with some of these upcoming cuts to Medi-Cal's, both at the federal and state level?
I think that people should be, whether they're on Medi-Cal or they have commercial insurance through an employer, should expect to see changes to the healthcare system. This is something that is going to play out over time. It's not all going to hit at once. And so the sort of ripple effects are likely going to be slow and play out over years. But one of the things that is likely to happen to everybody are premium increases to a certain degree. As hospitals, it very much depends on the market, but, as hospitals have these increased uncompensated care costs, they start to try and demand higher rates from insurers, which trickles down to everybody else. The state legislature also, in an effort to try and backfill a small degree of these cuts from the federal government, passed a new tax specifically on healthcare plans, and that is also going to equate to roughly $100 increase per person per year on commercial health insurance. And then you also will probably start to see some of those service impacts as well.
Kristen Hwang, healthcare reporter at Cal Matters. Thank you so much for being on North Bay 101 with us this week.
Of course. Thanks for having me.
So for our next segment, I am joined by KRCB News Director Greta Mart. Greta, you've been following a couple of particular stories this month. One is about the El Niño event, and the other about a woman who is currently swimming down the California coast. So what should we know about them?
That's right, Noah. And let's take the swimmer first. On July 1st, a woman named Catherine Breed left Brookings, Oregon, crossing over the Oregon-California border, but she was far out at sea. She's a pro swimmer, and she decided to swim down the entire California coast. She's expected to finish at the California-Mexico border sometime in October. Here's Breed addressing a crowd in Bodega Bay about her swimming background.
So I've been swimming since I was 4 years old. I always loved the water, and we grew up sailing in the San Francisco Bay and all over the Pacific Ocean. So for myself, the ocean has always been a safe place. It's always been my happy place. And my dedication to swimming from a very young age afforded me a full ride scholarship to UC Berkeley. Go Bears, anyone? Okay, we got a few. I was on 2 NCAA winning teams, 2 gold medals at the Pan American Games. And when I graduated, I still loved swimming, but I did not want to look at that black line anymore.
So Noah, Breed says it was after joining the Dolphin Club in San Francisco and she started swimming in the bay that she really got into other long ocean swims. She broke a 40-year record swimming the length of Lake Tahoe. She's done the English Channel, the North Sea, San Francisco to Half Moon Bay. So she's done a lot. And when she reached the Sonoma coast, she came ashore at Bodega Bay to talk about why she's doing this journey. She said she's partly doing this first-of-a-kind swim because she wants to inspire more ocean stewards and raise awareness for ocean conservation through stories and sport. Let's take a listen to this extended clip.
Why am I swimming the coast? That is probably the number one question. Second or first to, what about sharks? Which I'm sure someone will ask about. Why I'm swimming the coast is I love this place so much. You guys, I grew up in these waters. I surf these beaches. I spearfish. I love sailing. I come here to trail run, to bike. The coast is so special to myself, and I'm sure all of you are here because it's also special to you. And so as I swam the Half Moon Bay swim, I was like, I love this place. How is this possible? And someone had swam around Great Britain a little bit before, and I was like, okay, these swim expeditions, you can do them. So can I link the coast? And it became this intrinsic motivation of it's there to do. I care so deeply about it, and I know that I'm physically capable of doing it. So that was kind of the intrinsic. But then for myself, when you go after hard goals, you need a bigger why, because as 40,000 people saw me crying on my pillow yesterday, which I posted on social media, I'm much better today. You need something bigger than yourself to keep going in those moments. And the reason bigger is I wanted to tell a story of the coast, of the people, the places, the problems. someone coined this my love letter to the California coast, and I think that's exactly what this is. Women's sports, they're not having a moment. Women's sports are here to stay, but I think something women's sports do really well is this storytelling. And I don't want, this isn't coined Conquer California for a reason. It's coined Swim California. It's coined my love letter because we are working every day with what Mother Nature is giving us to traverse this coast in a safe way. And I wanted to tell the stories of the people we're meeting, and we've met so many incredible people. I wanted to showcase the places, the anchorages that we've stayed in, the places that we've gotten to see sunrise and sunset are truly going to be ingrained in mine and the team's minds forever. And not only that, though, the problems. There are some amazing success stories on our coast, but there's also ocean conservation problems that we need to be aware of.
That's Catherine Breed speaking to a crowd of about 60 people who turned out at Westside Park in Bodega Bay on a recent Sunday afternoon. I drove out there.
You said as well that Breed does her swimming pretty far away from the actual shoreline, like at least a mile, right? I mean, why is she swimming so far out? Even though I'm sure people want to be able to, stand on the beach and be able to get a look at her, I'm sure that there's a really good reason why she's taking this journey miles off the coast.
Yep. She says that she and her support team are anywhere from 1 to 5 miles offshore, mostly keeping out of the way of sharks and other marine creatures, as you can imagine, that usually stick pretty close to shore. She says she does her daily swimming boxed in by her support team, which is a 52-foot sailboat on one side and another boat on the other. And, the part I really enjoyed was she did quite a long Q&A with the audience in Bodega Bay. I noticed a number of teenage girls with their parents in the crowd.
So the question was, I loved the coast. Do I still love it? How is that? And is it really like swimming in a washing machine? To the first question, yes, I still love the coast. I do know more about it. I know that what I've learned in the water, every quarter mile, so every 500 yards, every quarter mile in the ocean is different. I'll be swimming and it's cold and there's lion's mane and it's slow water. And then a quarter mile or a mile later, it's fast water and the jellyfish are gone and the clarity comes. Or it could hit me the opposite way. I could have a great swim and then all of a sudden I go from crystal clear blue water to murky brown. I can't see anything. And so I really learned how dynamic our coast is, but in this very small, micro way. You look out at the ocean, you're like, oh, there's winds, they're just all prevailing. It's well, no, there's a lot of different changes that happen. And does it feel like a washing machine? Sometimes, yes. I think the way that I'll try to explain it is, if you think about me swimming and I take a breath, that is how far my mouth is out of the water, right? That's not very far. So if you have a wave that's 4 inches, that covers my face. Now, when I'm swimming in 20 knots of wind and 7-foot seas, that means I'm swimming up a 7-foot wave and then I have to swim down a 7-foot wave. And sometimes the wind and the waves and the current are all going the wrong direction. So it creates these little triangles, these really short period little triangles. And so I end up swallowing a lot of water. And then as I'm swimming, the water also is bouncing off the boat, which I'm very close to. So I'm getting hit from the side and then it's reverberating off the sailboat. So I go this way and it does take quite a lot of effort to go straight. So wouldn't recommend it, but if you ever do try it, you can put yourself in my shoes.
Wow. So that is some really serious dedication. Where is Breed now?
She's almost to Santa Cruz. You can track her live progress and read more at the website. It's swimcalifornia.com. It's a pretty fancy website, so you can, read all about it there.
That is a really inspiring story. Now, I know, talking about ocean environments, that you covered a town hall earlier this month about the El Niño event that's expected. So what is the latest story with that?
Yeah, so the latest is that it's not just expected, it's already here. El Niño is a cyclical event that happens naturally, and it's currently going on. For the past few months, we've been hearing about how it could be a super El Niño year for us, and that means a lot of rain this winter, what used to be called pineapple expresses. Meteorologists have been hearkening back to big El Niño years in the past, 1982, 97. And let me tell you, I remember 1997 because I was living on the leakiest wooden sailboat imaginable in Sausalito that year. And it really did rain for what seems in my memory like, weeks on end. It was relentless. Anyway, in early August, North Bay State Senator Mike McGuire organized a town hall about what current El Nino conditions could mean for us this winter. He invited like an ocean scientist from Scripps, a Bay Area TV meteorologist, a man from California's Office of Emergency Services, which is the state-level FEMA, and a well-known climate scientist. And for an hour and a half, they took public questions. Lots of people from the North Bay were in the chat.
Julie from Forestville writes in, what kind of ocean conditions will this weather event produce? We're getting a lot of questions.
You can watch that whole El Nino town hall on McGuire's Senate page or YouTube channel. And Noah, if you're really into weather topics and meteorology, I suggest following Dr. Daniel Swain. He's got a YouTube channel called Weather West. Here's a clip from his latest update.
For all intents and purposes, we now have a very strong El Nino event already in place. This is already an event that is reaching or exceeding all-time historic maxima in terms of how we measure El Nino intensity in terms of the warmth of the eastern tropical Pacific Ocean.
So essentially, the gist is this coming winter, it's pretty likely we'll be getting a lot of rain, atmospheric rivers, one after another. So the message in all of this coverage is, start preparing now, fix any pesky drainage issues around your home, start stashing sandbags, look around and think about, what can you start doing to batten down the hatches, so to speak, when the predicted storms arrive, if they do. And again, that's a big if, because in all of the talk about this El Nino, it is just prediction. So it's definitely not guaranteed that, it'll all play out like climatologists are predicting. But, if they do arrive, you're ready. And for those who are wondering about how this year's predicted Super El Nino will impact the Sonoma coast, here's Dr. Mark Merrifield. He's director of Scripps Center for Climate Change Impacts and Adaptation.
We're expecting likely the highest sea levels ever recorded on the California coast associated with this event. As a sort of unlucky coincidence, the tidal cycle is also going to be at a peak around the end of this year. So tides tend to vary over long time periods, 18.6 years, 4.4 years. We're at the peaks of those cycles. And around the Christmas time, we'll be seeing some strong tides, or super tides, or king tides, that will superpose on this rising sea level and El Nino event to give us the high sea levels. That combination, high waves, high sea levels, high tides, and as Dr. Swain mentioned, high rainfall, will contribute to considerable coastal flooding, intrusion of salt water into the groundwater, and coastal erosion.
Wow. Okay. Got it.
Yep. And, as always, Noah, the KRCB newsroom will be staying on top of how the season and predictions progress with stories about how the North Bay can get ready and stay safe.
KRCB News Director Greta Mart, thanks for being with us on North Bay 101 this week.
Thank you, Noah.
Thank you for joining us for the North Bay 101, where each week KRCB and North Bay journalists bring you the stories shaping California's North Bay. Our thanks to today's reporters and editors, Cal Matters health reporter Kristen Hwang and KRCB News Director Greta Mart. For more updates, follow along at krcb.org. New episodes drop every Friday on YouTube, the NorCal Public Media app, all major podcast platforms, and right here on KRCB 104.9, Sonoma County's NPR station. This episode of North Bay 101 was edited and produced by Max Allen, engineering for the series by Mark Prell, production support by Noah Abrams and Chandra Back, with digital support by Kelly Olson. KRCB FM is managed by Catherine Nelson. Our president and CEO is Darren Lachelle, and I am Noah Abrams. The nation's founders recognized a free press as an essential protection for the people. Today, KRCB's newsroom carries that responsibility with reporting that's accountable to the community we serve. Support trusted local journalism at krcb.org. Thanks for tuning in. We'll see you next week.